Government in India is he supporting?
It is very common in India.
How common are parasitic infections in children? Welcome to my podcast where I will be talking about ivermectin, mebendazole, febendazole, and other parasitic medications. I came specially from Europe to find out more about it. And I'm going to have a short podcast with Dr. Janak Lathia in Surat, a specialist for children. And he will tell us more because I see how big topic it is and many people don't know how to use it. So please stay with me. Hello, Dr. Janak. Thank you for joining us today. I would like to ask you more about you as a pediatrician. If you could tell us more about yourself and about your journey.
Hello, Natalia. I am Dr. Janak Lathia, working as a pediatrician in Surat, India, since last 12 years. Thank you for inviting me for your important topic on albendazole and ivermectin.
Thank you for joining. My first question is, how common are parasitic infections in children?
It is very common in India. About 80% of the children suffer from worm infestation. It is especially in the poor sanitation area.
How big are these numbers?
Almost about 80% of the children from age of 1 to 5 years suffer from worm infestations.
Okay. And what about the government in India? Is he supporting these children?
Government is doing great job as they provide albendazole to each and every children as it is in their schedule. We give albendazole every 6 months up to the age of 5 years.
Okay.
We get it from dispensary direct itself, and in few of the times government provide them to their home itself.
Okay, so that means it's like a normal process here.
Yes.
You're sick or you're not, this is like a prevention and it should be done every 6 months for every child to protect from parasitis.
Yes, it is a very common practice over here in India. Because if there is worm infestation, then there will be growth hampered and there will be less concentration in the studies. There will be anemia to the child. So it will be very easy to give each and every child,
Okay.
irrespective of diagnosing that child is suffering or not.
Okay. What are the most common symptoms that you notice in children?
Yes. See, in our routine OPD, symptoms like pain in abdomen is more common. Perianal region rashes and perianal region itching, and otherwise we can say some patients suffers from diarrhea, some patients suffer from constipation. So these are very few common symptoms in which child comes to us with symptoms.
Are ivermectin, mebendazole, febendazole safe for children?
In India, mostly we prescribe ivermectin and albendazole above the age of 1 year of children. Albendazole is safer rather than mebendazole and febendazole.
Okay, so you actually recommend in India albendazole, and that's
Yes.
the most common prescribed medication.
Yes, government also prescribe albendazole only, but in few of the cases we also have to go with ivermectin. So there are drugs in India where both the combination is available. So
Okay.
ivermectin with albendazole. So in few of the cases we give that also.
Can I ask what are the dosage prescribed here for albendazole and ivermectin for children, and how old they should be to take this dosage?
Okay, let me tell you stepwise. From the age of 1 year to 2 years, albendazole dose is 200 milligrams stat dose on the
Okay.
same day, and after 15 days you have to give one again 200 milligram dose of albendazole.
Okay.
And ivermectin, it is 0.15 milligram per kg, so almost related to 200 milligram you have to give 1.5 milligram of ivermectin, and that also same stat dose on the first day, and after 15 days you have to repeat the same dose. So there is combination only. So if you remember only one dose of albendazole, then ivermectin will go with along with that only. Like it is, see, it's like this. It's a combination of albendazole and suspension. You
For
can see.
children?
Yes.
Ivermectin and albendazole.
Yes. It is very common in India. You can get it from any pharmacy store. patient also know what are the doses also from, because when they come to us first time, we ask them every 6 months, you go to your nearby pharmacy store and purchase it yourself and give similar dose like stat dose, and after 15 days again. And the second thing, above the age of 2 years, you have to give 400 milligram of stat dose.
So the dosage is higher from 2 years old.
After 2 years of age, it is very higher. It is almost double. 200 milligram of albendazole and ivermectin also. Those will be increased accordingly to albendazole. So that also we have to give stat dose, and after 15 days you have to repeat one dose again.
Okay.
So it will completely dewormize children or in adult also.
Okay. What side effects parents should watch during deworming for children?
There are very few side effects of the drug, like nausea, bit of vomiting, sometimes rashes, and stomach upset. There are very few side effects, but not all of the patient suffer from the side effects. Very, very few children go through these side effects.
Okay.
So it is okay to give drugs by themselves.
What parents should do in case of this kind of side effects? Should they stop the medication or should they continue?
No, it is stat dose. Like we have to give at instant one dose. It is not a continuation dose.
Correct, and you are right. So, after 15 days,
yes.
It's another
so
one.
After 15 days, that side effect will be, if there is any side effect, then it will be only for few hours.
Okay.
Not one day also. It will be very few hours. Then after that, child will be okay also. So after 15 days again, you can go, because deworming is more important, and it is very helpful to them rather than seeing the side effect.
Okay.
It is important to give drug.
Okay, and do you also recommend kind of preparation before giving the medicine, like maybe reduce the sugar or get the special diet before deworming, or it should be?
No, you can give at any day of any time. Okay. It's not like any recommendation diet for deworming or anything.
Okay, and should they maybe drink more water on that day?
No, it's not such a specification. Okay. Yes, patient or parents, they both can watch for worms in their stool. So after deworming, they can see dead worms in their stool. So if they want to get confirmation, then they can watch in the stool.
Okay. And do you know for what type of parasites this medicine used? If you know, like.
Yes, parasite is a very big list of, but very common is Ascaris lumbricoides. It is very common in the soil.
In the soil?
Okay. So you can get infected through feet if you are not wearing any shoes or any other footwear. Okay. You can, second most common route is fecal-oral route. Means if there is poor sanitization, if you don't wash your hand after going through sanitization, and if you eat directly, or if you play in the mud. Children, it's very most common to play in the mud. And after playing in the mud, if they don't wash hand and directly eat their food, so that are main sources of infections. So it is very important to keep their hygiene clean to avoid worm infestation.
I think in today's world is very important because we travel a lot.
Yes.
And maybe we should take care. Actually, in Europe, this is not recommended.
Yes.
We don't follow this protocol like every 6 months, what you have in India. This is very interesting topic. Yeah. I think this is something we should look into. Is Ivermectin and Albendazole easily available in India? Do we need actually prescription in this country to get it?
Natalia, as I previously told you in our session, that it is very common in India to get ivermectin and albendazole without prescription. Government is only taking initiative that each and every child gets this albendazole and ivermectin, so that no child is left without medication. So it is very common. You can get it without prescription anywhere in India.
So this medicine is actually not something dangerous, and it can be used every 6 months, and it doesn't cause big side effects.
No.
In the low dosage as prescribed.
If you give it in the correct dose, then there is very minimal side effect. So you can give it every 6 months up to the age of 5 years. So up to the age of 5 years, children who are growing, their growth is not hampered during that time. So it is better to give every 6 months during their growth period.
What about ivermectin, febendazole, mebendazole, and albendazole? How they different?
Okay, see, albendazole, febendazole, and mebendazole, they belongs to one family. Their mechanism of action is same. While ivermectin, it is different. But in India, for dewormation, we only give albendazole. Febendazole and mebendazole is not very frequently used. So combination of albendazole and ivermectin will be available in almost all the pharmacy, but you won't get febendazole and mebendazole. And there is also one other drug. It is called metronidazole. So in the cases where we give albendazole, and if patient still suffering from worm infestation, then we have to give metronidazole dose for 7 days, consecutive days.
And what is the dosage for this?
It is 400 milligram per day.
Per day.
Yes.
Is the age?
Yes, you have to give about the 2 years of age, and you have to give it for 7 consecutive days. And how can you diagnose that child is suffering from this worm infestation? Then there is swab test. In that, they take swab from the perianal region, and they look for the eggs. And if there is egg seen in that swab, then it is confirmation that patient is suffering from the worm infestation, and you have to give. But each and every time it is not possible, so we assume that all the child is suffering from this disease, and we give it to all the children.
And how this test is actually a cure, like how, because as what I'm reading from people, and that's what they say, it's like they do the test and nothing on the test is always negative, but actually the worms are there.
No, it is not possible, because see, if there are symptoms like I told you, the most common symptom is perianal region rashes or perianal itching. So if there is itching, then definitely there will be eggs.
Okay, yes.
So clinically, once you diagnose clinically that patient is suffering from this, and if you want to confirm, then if you will do swab test, then it will be confirmation that it is child is suffering from that.
Okay. Please consult professional doctor before taking any medical decisions.